Today I'll be talking on bone marrow examination. What are the indication on what is the technique for doing it? So first, I would like to talk on bone marrow cellularity that varies as per the age. In infant and in children, the 100% of the skeleton, axial and appendicular, both has active bone marrow. As the age increases in adult, it decreases from 100% to 50%, and main part of the bone marrow in adult is only the axial skeleton, and rest of the part is replaced by yellow marrow, that is fat. So now the indication. First, I have highlighted indication from my side from medical oncology field in a bold texture. So first is the unexplained anemia. Second one is the unexplained leukopenia or thrombocytopenia, and any pancytopenia or presence of blast cells on the peripheral smear that suggests possibility of leukemia or suspected multiple myeloma. Another, there may be some non-oncological causes like macrocytic anemia that we distinguish megaloblastic from normoblastic maturation. And also, there is in oncological cases like non-Hodgkin lymphoma, we do bone marrow for staging purpose, also for hairy cell leukemia, and some storage disorder like Poucher disease and Niemann-Pick disease. Sometimes fever of unknown origin, we are not finding any cause for fever. Then also we should do bone marrow. There may be some brucella and other infection that may be found on the bone marrow. So now, is there any contraindication for bone marrow? The only absolute contraindication is severe bleeding disorder, that is a severe hemophilia or severe DIC. So there is also a question like if any low platelet is a contradictory factor for bone marrow. So the bone marrow examination is safe in low platelet count. Even in acute leukemia, in 5,000 of platelet we have done, and we have not found any significant bleeding tendency. But platelet count below 20,000, we should take care, and we should keep the patient in post procedural period for, and we should watch for the bleeding. So, do we need to stop any anticoagulant or antiplatelet? So the answer is no. But there are two school of thoughts. Most of the guidelines say that there is no increased chance of bleeding, and we can continue with the anticoagulant and antiplatelet. Some also tells that we should stop warfarin and we should wait for the normalization of the PTINR before proceeding with the this procedure. Now, I will like to start with the sites of the bone marrow examination. So the most common site is the posterior superior iliac crest. And here, this is the most common site. And because this can be done in lateral decubitus position, and that is the most accessible area. And the pain with this site is less compared to the other site. But if the patient is severely obese and patient has some skin disease over this side, then we can choose this anterior superior iliac spine also, and that part we can do biopsy. Other rare areas are greater trochanter of femur or vertebral body and ribs that we are rarely doing. In infants, iliac bone is not properly ossified, hence we choose the anterior tibia, and at that site only aspiration is possible. Another site is sternal marrow aspiration that can be done only at above 12 years of age group. And here also we only do aspiration, no biopsy, because risk of that sternal plate is very thin, and we can damage the bone over there, and we can also cause injury to the thoracic organs. So, do we need to do both aspiration and biopsy both? So the answer is yes. In almost all cases, biopsy helps to know the cellularity of the marrow. So it helps in the proper staging of the disease, mainly in our malignancy part, and it also confirms the severity of the disease. Now, another question is one side sample, like one ipsilateral sample is sufficient, or we should do bilateral bone marrow? So common practice is unilateral, but yes, in some of the disease, we should do bilateral bone marrow. And in that, first is a neuroblastoma, that in that bilateral bone marrow examination is mandatory. In some studies, they have shown that for staging of non-Hodgkin lymphoma, we should do bilateral bone marrow. But some newer upcoming studies are showing if we take enough length, and then unilateral bone marrow is enough. Now, do we need to give any pre-medication? So, bone marrow is done under local anesthesia, and it has low to moderate pain with a score of 3 on the scale of 0 to 10. So, we only do give local anesthesia, but in highly anxious patient, we may give parenteral painkiller before procedure. In infants and children, we do this procedure under sedation. Now, do we require any assistant with us? Yes, it is mandatory because the main doctor will be handling the bone marrow aspiration and biopsy part. So we'll require some experienced staff who is expert in slide making and sample collection in containers. So the benefit of this is that if we have some assistant, then we can avoid the clotting of the sample, and the risk of infection can be decreased during the procedure. So these are the types of needle. This is Jamshidi bone marrow needle. We commonly use this type, and first one, this is aspiration needle only, and this is the aspiration and biopsy needle both. This is the stylet that we use for collection of the sample. These needles are available in different size. Commonly, we use 10 centimeter with 11 gauge size. And as the obesity increases, we can increase the length of the needle, so we can take the proper sample. We do test for the bone marrow aspirate and biopsy with routine histopathology, and also we have some special investigation like ISC, flow cytometry, chromosomal analysis, and FISH, and some genetic testing for proper diagnosis of the disease and proper prognostication of the disease. So now we'll move forward with the technique. So we start with our consent. We explain the patient whole procedure. We do assure the patient regarding safety of the procedure. And this procedure is being done in two positions. The most common is lateral decubitus, and another is the prone position. It can also be done in prone position. We palpate the anatomical landmarks, and it is commonly 3 centimeter with 3 finger breadth from the midline and 2 finger breadth below the iliac crest. So here is the part we take sample here from the posterior iliac crest. So all this procedure is done under strict asepsis. Proper painting and draping protocol is being followed, and here we prepare the bone marrow tray. It contains bone marrow aspiration biopsy needle, and all the syringes, needles, and aspiration needle also. We do this procedure under local anesthesia with the help of 1 to 2% lidocaine using 23 gauge needle. We infiltrate the skin and also periosteum, and the area that we infiltrate, it should be wide. It should be in all direction, and subcutaneous tissue also should be covered. So we infiltrate whole of the tract of our penetration, so the pain can be minimized. Then we put a 3 millimeter skin incision with scalpel blade, and then bone marrow needle perpendicular to the skin is to be entered. Once we feel bone after penetrating the subcutaneous tissue and muscle, then we should change our direction to the anterior superior iliac spine, and then we move ahead with the screwing movement with gentle pressure. And when we penetrate the cortical bone and we enter into the bone marrow, we feel this giveaway feel, and then the needle it stays without any support, and at that time we are in the bone marrow. Then we remove stellate, and then we do aspiration. So we take only 0.2 to 0.5 ml of the aspiration. It is important to warn the patient that there can be sharp pain during this time, because aspiration always cause pain, and the initial aspirate is to be taken only 0.2 to 0.5 ml, because it is very concentrated with cells, and if we take more sample, then it will be diluted with peripheral blood, and then there will be false information in the sample, and we may not get adequate result from the bone marrow aspirate. So we always take the sample from 2 ml syringe only, and then we give that sample to the assistant, and then he or she prepares a slide preparation, and he also collects the sample in the anticoagulant container. The commonly used anticoagulant container we use is the EDTA. So here is the picture showing the prepared slides. we can see the bone spicules over there, and that is the ideal slide that is being prepared. We commonly use particle crush technique. Here we put a drop of blood at the corner of the slide, and then we, with the help of second slide, we make a thin film, and then we just crush the slide with each other, and then spread it in a longitudinal way. Here, this technique requires some expertise, but with this technique, we get best result in the aspirate. After that, we reinsert the slide stellate again in the needle, and then take needle to back at some extent and reintroduce to the bone at different direction, because we have already taken some sample of aspirate, so we need to take a fresh sample for bone marrow biopsy. During this, again, we do this time we do 360-degree movement of the needle, and we we take it in a multiple. We make it in clockwise and anti-clockwise, and this is to be done to separate the marrow sample from the main bone marrow part, and then we advance a little further, and then we take the whole of the sample. Here the needle is also slightly curved at the end, so it can take the bone marrow sample with while we withdraw the needle with us. So after that, we put the stellate from reverse, and then we take the bone marrow sample, and we can see the bone marrow specimen. It is red. It is not. If it is white, then it is like cortical bone. If it is glistening, then we have collected the cartilage. So it is an ideal specimen. The at least length should be 3 to 5 mm. But if we are getting 2 centimeter, then it is good for lymphoma. And then we also make a bone print. We, with the help of second slide, and we roll over the slide with this bone print, bone sample with the help of second slide. And after that, hemostasis is achieved, tight dressing is done, and then we preserve this sample in the formalin. So we have done the aspirate, we have done the bone marrow biopsy. Now, post-procedural patient is advised to remain in supine position for 15 to 20 minutes. And for painkiller, we do give oral paracetamol, and we should avoid, we advise patient to avoid exertion for next 24 hours. We do not feel any complication during this procedure, but it may be bleeding or infection. There are some rare side effects also, like tumor seeding and needle breakage, but it is not seen commonly. In sternal aspiration, there may be some chances of thoracic organ injury, and that is good. Thank you.